what we did, we sought to look at all the already published, but also at all the yet to be published studies on CAR T-cell therapy against BCMA in relapsed refractory multiple myeloma, and to look at the response, duration at response if possible, and if reported, and on the relapse incidence overall survival. And what we found was that the response rates, overall response rate, complete response rates were quite similar across the studies, across the published studies, which were 5 until now. And in the 15 CAR T-cell studies which were not published yet, but which were published at and presented at the hematology meetings during the last 2 years. And we found that the overall response rate across the studies is quite good, it's about 80%. And the complete response rates varied across studies, but mainly in the median were at 20 to 30%. And that the MRD negativity was quite good, was quite high at 60 to 70%, and was quite similar as well across the studies. The yet challenge in the CAR T-cell studies is the duration at response, which has to be reported on for longer follow-up, because the studies until now have only a follow-up of 12 months at the maximum. The larger studies, CARMA studies, CAR-T2 studies with longer follow-up are not published yet, but are quite promising. And another astonishing finding was that the complete cytokine release syndrome and the neurotoxicity in myeloma are quite low. The rates are quite low and are quite also quite similar across the studies, with the cytokine release syndrome in severe grades, grade 3 to 4, are about 10 to 20%, as well as the severe neurotoxicity at 10%. Another finding was, which has to be, to our point and to our view, has to be focused more, is the population with extramedullary disease, which didn't seem to be affected by the CAR T-cell therapy, meaning that the response for patients with extramedullary disease and without extramedullary disease were the same, which is quite surprising, given that extramedullary disease at diagnosis as well as at relapse shows poor outcome. And that was really promising, because for extramedullary disease patients, the options at the moment are quite rare, and that's a really promising finding. And but the main thing is that we need longer follow-up for especially for duration of response and for overall survival. Because we looked at the 5 studies which were already published, and the overall survival at 12 months was 80%, but the relapse rate was about 50%. So the question is, what are the mechanisms behind that, and what are the results after 2-3 years? So we need more and better and longer follow-up. That is the main thing, because the summary is quite simple. The CAR T-cell, in view of the response, they work. In view of the safety, they work. And in patients with extramedullary disease, they work extraordinarily. But now we need longer follow-up, larger studies, and more predictive studies, so multivariable analysis with predictors for poor outcome or for even a high outcome over a long period of time.